This video is presented by Etiology. In this video we would like to talk about hamstring injury. The mechanism of injury, pathoanatomical features, clinical course, and treatment strategies. First, we would like to talk about anatomy for medical students or who are interested in anatomy.
The hamstring muscles are composed of three muscles, including biceps femoris, semitendinosus, and semimembranosus. To display the muscle's location, we want to view it in close view. Biceps femoris, semitendinosus, and semimembranosus. We will examine each muscle individually to explain its origin, insertion, action, and nerve supply or innervation. We would like to start with biceps femoris. Biceps femoris has two heads, short and long head. Origin: the long head rises from the ischial tuberosity. The short head rises from the linea aspera and lateral supracondylar line of the femur. Insertion: the two heads unite and insert on the lateral side of the head of the fibula. Action: biceps femoris flex the leg at the knee. When the knee is flexed, the muscle rotates the tibia laterally from the femur. The long head also extends the thigh at the hip. Innervation: the long head is innervated by sciatic nerve, tibial division L5, S1 and S2. Short head also innervated by sciatic nerve, however, peroneal division L5, S1 and S2. Semimembranosus. Origin: rises by a thick tendon from the ischial tuberosity. Insertion: its tendon inserts on the posterior medial aspect of the medial condyle of the tibia. Action: the muscle flexes the leg at the knee and rotates the flexed leg medially. It also extends the thigh at the hip joint. Also, it extends the trunk. Innervation of this muscle is also sciatic nerve, tibial division L5, S1, and S2. And the last muscle is semitendinosus. Semitendinosus origin arises from the ischial tuberosity of the pelvis. Insertion: its prominent tendon inserts on the medial surface of superior portion of the tibia. Action: flexes the leg at the knee, and when the knee is flexed, medially rotates the tibia. It also an extensor of the thigh at the hip joint. Innervation of this muscle is also sciatic nerve, tibial division L5, S1 and S2. The tendon of the insertion combines with the tendons of gracilis and sartorius muscle to form the pes anserenius on the medial aspect of the knee.
Mechanism of injury.
Hamstring strain injury can lead to significant impairment, activity limitation, and participation restriction, which can result in time lost from competitive sports. Overloaded and overexploitation injuries of myofascial or musculotendinous structures in any combination of the three hamstring muscles, the semimembranosus, semitendinosus, and biceps femoris. The high injury rate is also an important issue. Typically, hamstrings are classified by the involved muscle, anatomical location, and severity of damage. Classification also may consider whether there is myofascial, musculotendinous, both muscle and tendon tissue, and or intratendinous involvement within a single tendon. A variety of injury mechanisms for hamstring injuries have been described and typically involve some type of eccentric overloading and or overstretching in position of hip, flex, and knee extension. Sudden springing cause hamstring injuries. When the hamstring is eccentrically contracting across the hip and knee and late in swinging phase, early heel strike. This overload injury usually involves the biceps femoris and surrounding tissue. In contrast, overstretching injuries occur with combined hip flexion and knee extension movement as kicking or reaching to pick up and lift something off the ground when the knee extended. This overstretching injury typically involves the proximal semimembranosus.
Re-injury risk and return to play
Are common in functional activities that involve high-speed running, jumping, kicking, football, rugby, dancing, and all explosive lower extremity movements with rapid changes in direction, including lifting objects from the ground and with each additional year of age. Hamstring strain injuries often result in a significant loss of time from competition, usually ranging from 3 to 28 days or more, depend on the severity of the injury. The rate of injury is high and ranges from 3.6 times and high incidence of recurrent hamstring injuries could be due to inadequate rehabilitation or early return to play. Skeletal muscle consists of slow oxidative
pathoanatomical
type 1
features.
and fast oxidative type 2 muscle fibers. The hamstring muscle group is believed to have a higher percentage of type 2 fibers than other thigh muscle, therefore make the muscle more susceptible to injury. Furthermore, anatomically, an hamstring injury may be more likely to occur if the hamstring muscle group is in a lengthening position by an increase in anterior pelvic tilt. Risk factors for an hamstring injury include a history of anterior cruciate ligament injury as well as other knee injuries, ankle ligament sprains, calf quadricep strain. Hamstring weakness is a risk factor for hamstring injury. The hamstring muscle that is most commonly involved in both first-time and recurrent injuries is the long head of the bicep femoris.
Clinical features.
An hamstring injury can occur anywhere along the length of muscle, but occurs most frequently in the proximal bicep femoris at the musculotendinous junction. When the injury occurs, an individual experiences a sudden sharp pain in the posterior thigh. Additionally, an audible or palpable popping sensation often occurs during an activity that overloads and or overstretches the hamstring muscle. The individual may stop the event or activity due to pain and limited function. With greater injury severity, the extreme tensile and shear force result in additional fascia, basal lamina, and blood vessel tearing. Degradation and inflammation occur following the injury. Blood vessel damage results in bleeding and clotting. Clinically, pain, swelling, bleeding, and loss of function and loss of range of motion.
Diagnosis.
Early and accurate clinical diagnosis of an hamstring injury is crucial for providing appropriate treatment, determining return to play, and preventing injury. Although evidence for the use of clinical examination to diagnose an hamstring injury is limited, an individual presents with a sudden onset of posterior thigh pain during activity, with pain reproduced when the hamstring is stretched and or activated, muscle tenderness with palpation, and loss of function.
Treatment and modalities.
The practitioner may perform neural soft tissue articulation and early range of motion after injury to reduce adhesions to surrounding tissue and may help promote more organized scar formation, including controlling pain and swelling early in the healing process. Furthermore, adjusting the pelvic level. The aim of acute hamstring injuries before and after interventions is to alleviate impairments of body function, structure, activity limitations, participation restrictions, and individuals' ability to walk, run, and sprint. The remodeling phase can last for up to 2 years based on the extent of the hamstring injury.
Interventions. Injury prevention.
The practitioner should incorporate the hamstring exercise into their hamstring injury prevention program, along such as warm-up, eccentric training in patient tolerance, in addition to stretching, strengthening, stabilizing, and progressive running programs to improve return to play time after an individual has undergone hamstring injury.
One more time, we push our leg, you will feel that you engaging your hamstring, you feel that is tight, and you release again. So you do 3 times. Again, contracting muscle. If you want to make it more harder for yourself, you can lean forward, and then you will feel all burning or tightness or contraction of muscle. So you can do the same things with the left leg. Same action. You pull. Sometimes also, if it's very high, you can lean down. So you're stretching your hamstring. So we would like to show you a few hamstring strengthening exercise. You can do isometric, eccentric, and isotonic muscle exercise. Once you have done 10 reps, then you can switch to leg. Now we're working strengthening adductor muscle. This is for adductor. Now same thing you have to do with this leg. And after hamstring and adductor, we need to also work on quadriceps. As one of the risk factors of injury of hamstring, weakness of quadriceps. Same quadriceps as well, you do 10 reps.
Isometric muscle length stays the same.
Once I'm holding weight, and I'm not moving my leg. Isometric. So I hold the weight 10 seconds, and then I release. Same thing, like 10 seconds. Because I'm not moving the joint. Eccentric is that when from here, I'll show you this way. Eccentric
Eccentric lengthening of the muscle.
lengthening the muscle. So from this position, I am lengthening. I'm letting hamstring muscle length. Again, bringing toward myself. Gradually, I'm releasing the weight. Also in this position, you can still focus on your hamstring. You can keep the weight in this position. You will still feel your hamstring muscle is engaging. Once you feel it's contracted, that means you are engaging muscle, you're working on the muscle.
The classification of the hamstrings injuries.
Contusion, compartment syndrome, and thrombosis. Thank you very much for watching this video. Please do not forget to subscribe and see you in next video.